I'm Nick. Welcome to our Ghost Productions VR lab. I'm going to show you something that we've built, a great demo on this new Oculus Rift S system. This is our new system. I'm eager to show you our demo. So without any further ado, I'm going to go into our virtual space. So now you'll see me in virtual space. You can see here's my head, and I have hands, fully functional hands. I can use all my appendages. You can see that. I can also use them to grab these tools over here, like this pin driver, and pull triggers. Or this saw. Okay. So this is our surgical environment you can see here. There's a couple of things we've done. We've branded to the Ghost Productions logo, and I'm also in what's called room scale VR, so I can walk around the patient. I can walk up to the patient's head. Hey, patient. Make sure they're still alive. Are you alive? And I can walk around the other side of these tools over at the other side of the patient too. Here we are. And into the microphone. Sorry, everybody. Okay. And the first thing I'm going to do is put the knee into 90 degrees of flexion. So I'll grab the ankle here. I'm given a highlight to help me see the goal where I want to put this leg. Okay, there we go. All right. So now we have it 90 degrees of flexion. I'm going to select a scalpel from the Mayo stand. And now I can see that there's a highlight to help me know where to start my incision. There's also a line down the midline of the patella to tell me where I should make this incision. So I'll go ahead and do that.
The scalpel to make the incision starting just above the patella.
Okay, so we have the incision made. Now, one of the things we worked really hard on was to develop a soft tissue deformation system so that the user can interact with the skin's incision margins with our fingers and manipulate it to help the user feel like a more immersive experience, to have flesh reacting to our touch as users. I also have a few tools on the Mayo stand I can use to manipulate the soft tissue finger retractors. For this demo, I'm going to use these forceps retractors, and they're fully functional. I can squeeze them and open them up here. So I'm going to place them in the incision and retract it.
Select the scalpel from the Mayo stand to your left.
So now I'm ready to make the incision through the joint capsule to gain access to the joint space. So I'll grab the scalpel again.
Use the highlight as a guide.
Again, I'll be using this highlight as a guide to make this incision.
Continues around in proximal. Grasp the patient's left ankle, preferably with your left hand.
So now I will put the leg back into full extension so I can dislocate the patella. So I'll grab the ankle and follow the highlight down to full extension. Okay, now I'll grab the patella and dislocate it laterally across the knee, and at the same time everting it so that when I put it in full extension again, it's held on the lateral side of the knee. So now you can see the patella, the back side of the patella is now exposed, and our joint space is exposed for the next steps here. So now we're up to using some of the OmniBotics tooling. The first thing we're going to do is put a cortical pin about 4 finger widths down from the tibial tuberosity. I'll use this pin driver that already has a pin installed. Okay, I'll set that down because I'm going to need it again. Now I can grab the tibial array. You can see it's shaped like a T. I can put that on that pin, and then put the second pin in to anchor it. Okay. So now I can select the femoral target array. It's got an F. And I can put it on this highlight on the medial side of the knee. And it's held there by my virtual assistant while I put these 2 fixation pins in. I'll walk around to the other side of the patient to do that. Okay.
Install the first anchor pin, securing the femoral
So I'll put this first pin in.
distal femur. Grab the pin driver. Select the
Okay.
section guide.
Okay, now I'll walk back around so we can do the next part. Okay, the next thing I'm going to do is grab this nano block. It has a targeting array on it, right on the anterior part of the tibia, and it's anchored with these 3 pins. So I'll grab the pin driver again and put these 3 pins in. Real quick.
Grab the bone saw to resect the tibial.
Okay. Now I can use the bone saw to resect the tibial plateau. So we'll be able to cut in this guide. Once the tibial plateau is resected, the piece is removed. Now I can remove the nano block with the pin driver, take the pins out. My virtual assistant will hold the nano block for me while I put the pin driver back, and then I can grab the nano block and put it back. Okay. So now we can get the eye block. It's the femoral resection, robotically assisted femoral resection guide. It's called the eye block. So we can put that right on the medial side here. And now you'll see that it's automatically adjusting for the first cut, the distal cut on the femoral condyles. I'll grab the bone saw and make that first cut, removing the anterior, or the distal ends of the femoral condyle. Okay.
The eye block will now adjust trajectory.
Okay, now we're ready for the anterior resection. Okay. The posterior. Okay. And the anterior chamfer. And lastly, the posterior chamfer cut to complete the femoral resection. Okay. All right, there we go. Okay, now I can return the bone saw and return the eye block to its position on the Mayo stand. There we go. Okay, now we have the knee completely prepared for our implantation. The first thing we're going to do is put the tibial base component in with this impactor. You can see the impactor is connected to the tibial base, and I'll grab this mallet to impact it into the top of the tibia. Now to impact it into its final position on the top of the tibia there. Okay, that looks good. So now I can add the femoral shell component on the distal side of the femur. And lastly, I'll put the poly inlay component between these two. Okay, and so in our next steps, we'll be running this knee through a few range of motion tests to test our final implantation and return it to normal. That concludes our demo for now. See you, everybody.